Good afternoon, everyone. My name is Chai Eileen, so I will be the moderator for today. Firstly, I would like to thank everyone to be here today. Let me begin to introduce our SDG goal, which is good health and well-being. This goal aims to prevent the needless suffering from the preventable diseases and premature death by focusing on key targets that can boost the health of a country overall population. So, our title for today is Vaccination should be made compulsory for all citizens. Before the discussion begins, let me introduce our panel. Our panel for today is Nur Afira binti Jinot, Viviana Udin Ishek, Natalie Kinley, and Nataliana Anatawas. So, Nur Afira binti Jinot, can you share with us what is your opinion about the title?
Thank you, moderator, for the opportunity given to me to contribute towards today's discussion. So today I would be the first speaker from the proposition panel, in which I believe with the motion for today, which is vaccination are compulsory for every citizen. This is because I believe that vaccination are safe and effective. This is supported by Savulescu on his article of Good Reasons to Vaccinate. He suggested that vaccines are safe and effective. World Health Organization also came up with a statement which said that COVID-19 vaccines are regulated for safety and effectiveness. Although short-term side effects or adverse reactions have presented themselves, for instance, fever, fatigue, and pain, but vaccines are thoroughly tested before being approved for use. In the United States, they go through years of rigorous clinical trials involving thousands of patients to determine safety and efficiency. Even after approval, vaccine monitoring continues to ensure incredibly rare side effects are identified and treated immediately. In conclusion, no medical intervention is 100% risk-free, but the extremely small risks of vaccination are outweighed by the reduction in disease, disabilities, and deaths they provide. Ongoing surveillance and numerous long-term studies continue to support the excellent safety profile of recommended vaccines. Maintaining high community immunization rates blocks the spread of preventable contagions, protecting vulnerable populations. Therefore, available evidence wholly validates vaccination as safe and effective public health measure for people of all ages. That's all for me. Thank you.
Thank you for your opinion. Now, let's move on to the next panel. Viviana Udin Ishek, do you think vaccination should be made compulsory for all citizens?
Thank you to our moderator for giving me the chance to speak on this matter today. I am standing as an opposition panel for our discussion topic for today, which is vaccination should be made compulsory for all citizens. I disagree with this statement or discussion topic today because for me, forcing people to get vaccinated against their will will make the will make people lose their trust in health authorities. When people lose trust, it can cause the people to reject health advice more often. So why people cannot be forced to get vaccinated? People will feel the government has too much control if vaccinations are compulsory. People should be able to make their own health choices for their bodies. Removing this freedom through mandates can undermine trust and consent. While public health is important, bodily integrity and personal choice matter too. Reasonable people disagree on mandatory vaccinations because there are many pros and cons to weigh. There are no easy or obvious answer. So that is all my explanation for our discussion topic. Thank you.
Okay, thank you for your sharing. Next, we would like to ask Natalie Kinley to give you knowledge about this title.
Thank you, moderator. I stand with panel number two, Viviana just now, on why vaccine should be compulsory to all citizens. In my opinion, vaccination can cause an allergy reaction. It may be rare, but can happen in some circumstances and even be fatal. But nowadays, due to the increased amount of vaccination, allergy reaction become common. What is the component in the vaccine? So in order to prepare the vaccine, it includes active immunizing, antigen, conjugating agent, preservative, stabilizer, antimicrobial agent, and many more. And almost all of the components I stated can be considered as a potential trigger to an allergy reaction. In other cases, the primary allergen in the vaccine are protein. The protein most often implicated in vaccine allergy are eggs and gelatin. For example, there are studies stated that there are small amount of eggs in influenza vaccine. According to Wood R.A. in his research for treatment of patients with hypersensitive reaction after vaccine in 2008, the average rate of for type reaction in children and teenage is 0.22 per 100,000 doses of vaccination. So total 31% of patients reported immediate type of reaction such as diarrhea, abdominal cramping, rashes, joint swelling, and many more. So usually this reaction occur within a minute after vaccine. The advanced vaccine technology nowadays allow to improve targeting of the immunologic effect of vaccine. Human clinical trials of new vaccine should be carefully monitored to avoid such reaction. So that's it from me. Thank you.
Thank you for your opinion. Lastly, Nataliana Anatawas, do you think vaccination should be made compulsory for all citizens?
Thank you, moderator. I stand with panel number one. Let me continue as the proposition panel for today. I agree with our title, which is vaccination should be made compulsory for all citizens. My point is, being vaccinated can prevent disease and save life. Vaccinations are crucial tool in preventing disease and saving life. Vaccinations work by stimulating the immune system to recognize and fight against specific pathogens such as viruses or bacteria. When a person is vaccinated, their body develops immunity to the targeted disease, and it will making them less likely to get sick or experience severe symptoms if they do get infected. Besides that, being by getting vaccinated, individuals not only protect themselves but also contribute to the concept of herd immunity. This means that when a significant portion of the population is immune to a disease, it will become harder for the pathogen to spread. And it will protecting those who cannot receive vaccines due to the medical reasons or age. That's all from me.
Thank you for your opinion. To conclude this discussion, vaccination seems to have its advantages and disadvantages. The advantages is it is safe for everyone and it can prevent diseases. For the disadvantages, it can cause allergic reaction and make people lose trust in the health authorities. Thank you, everyone.